Today we welcome Professor Ted Dinan. Ted Dinan is a principal investigator at the APC Microbiome Ireland and Emeritus Professor of Psychiatry at University College Cork. Following his position as Senior Lecturer in Psychiatry at Trinity College Dublin, he was appointed Chair of Clinical Neuroscience and Professor of Psychological Medicine at St Bartholomew's Hospital, London. He's a Fellow of the Royal College of Physicians and Psychiatrists and a Fellow of the American College of Physicians. Professor Ted Dinan is world-renowned for his research investigating the role of the gut microbiota in stress-related disorders and has published over 550 scientific papers as well as numerous books on pharmacology and microbiology and neurobiology. In 2019, he was ranked by Expertscape as the #1 global expert on the microbiota and also listed in the top 100 global makers and mavericks. And he was awarded the Melvin Ramsey Prize for his research on the biology of stress in 1995. Ted, we are extremely grateful having you here with us today and that you can share with us your knowledge on the gut-brain axis in human health.
It's my pleasure, Marcus.
In the past 5-10 years, Ted, we have seen an explosion of research on the gut-brain axis. What is this gut-brain axis? Can you tell us more about it?
Right. The view on the gut-brain axis has changed very radically since I commenced research. When I started research, it really referred to the way in which the brain controlled the enteric nervous system, or the second brain around the gut, and how the gut via the enteric nervous system communicated with the brain. Now, at that stage, no one considered microbes as being important in the brain-gut axis. They were simply regarded as commensal. They didn't do us any harm, but they didn't do us any good. Of course, we now know that microbes are a fundamental part of the brain-gut axis, and I think it's probably better to label it as the brain-gut microbiota axis. And what it essentially is a two-way connection. So you have signals going from the brain to the gut microbes, and you have signals from gut microbes going to the brain.
So you mentioned the crucial role of the gut microbes in this communication. The gut microbiome is suggested to play a role in early life, in brain development as well, may impact brain health at later life stages. Can you tell us more about it?
Indeed, the gut microbiota plays a very important role in regulating brain function throughout the entire lifespan. As you point out, early on, during the neonatal period of development, the gut microbiota doesn't have the complexity that it does in adulthood, but it produces a vast array of molecules that are necessary for cognitive development. I mean, there's an enormous development of the brain within the first few months of life, and a healthy gut microbiota enables that in early development. Now, when we move into adulthood, the gut microbiota structure is far more complex than it would be in a neonate. Of course, that complexity can be interfered with by the use of antibiotics, or indeed by many different medications. I mean, many people take proton pump inhibitors because they've got gastric acidity, and drugs like that can impact the gut microbiota. We all want to age healthily, and it's become increasingly clear that as we age, we need to maintain diversity in the gut microbiota. There are studies looking at very healthy elderly people in their 80s, and they have a gut microbiota similar to someone in their 30s or 40s. But if somebody loses the complexity of the gut microbiota and they lose the diversity of the gut microbiota as they age, frailty follows rapidly. So definitely the gut microbiota plays a very important role throughout the lifespan. It plays a role in relation to cognitive function, and it also plays an important role in relation to emotional health and well-being.
And are there ways how we can actually modify the gut microbiota? What role would diet play, nutritional interventions?
A very important question. undoubtedly, the most important influence on the gut microbiota is our diet. I mean, obviously, if somebody takes an antibiotic, that's going to have a dramatic impact on the gut microbiota. But assuming one is reasonably healthy and one isn't on any medication, the biggest determinant of gut microbiota structure is the diet. And in adulthood, it really is important to have a diverse diet, because diversity in the diet leads to diversity in the gut microbiota. So the presence of a lot of fruit and vegetables, the presence of fermented foods, nuts, grains, these all have a very important impact on the gut microbiota. So of course there's fish. I mean, you know, we've known for a long time that EPA and DHA as polyunsaturated fatty acids have a good impact directly on the brain, but it's only in recent years that we've realized that they act as in a prebiotic way, increasing the diversity of the microbiota. So I think if one was to simplify the best, or the description of the best diet for one's gut microbiota, one would have to say that a modified Mediterranean diet is the most extensively studied and probably is the diet for the healthiest gut microbiota.
Mm-hmm. And do you think can also probiotics or bioactive compounds such as human milk or leukocytes be used to directly target the microbiota and with that positively impact brain development in early life, or also at brain health at later life stages?
Indeed, HMOs have a very important role to play early on. We know that HMOs will promote growth, really healthy microbiota in the neonate. They're bifidogenic. They promote the growth of bifidobacteria, which are good bacteria. They enable the development of the immune system, the optimal development of the immune system. And of course, they also play a role in excluding pathogenic bacteria and viruses from the intestine. So early on, undoubtedly, HMOs play a very important role in relation to gut health and brain development. Of course, later on in life, fermented foods and probiotics, which of course, you know, can be present in fermented foods, can have an important role to play, because we know, for instance, that certain probiotic bacteria can regulate the stress, play a role in regulating the stress system. The core stress axis in man is the hypothalamic pituitary adrenal axis, and we know that certain probiotic bacteria, particularly bifidobacteria, can regulate that axis and probably enable people to more appropriately deal with stress. We also know that certain probiotic bacteria, again bifidobacterial strains, can produce tryptophan. Now, we've traditionally viewed tryptophan as coming directly from the diet, but in fact, some bifidobacteria can produce tryptophan, and tryptophan is the building block of serotonin and plays a fundamental role in regulating our mood and our sleep and our, you know, our general well-being. So undoubtedly, various components like HMOs in the diet and probiotics can have a very important role to play in regulating our brain and our mental health.
Mm-hmm. And where do you see the field in the next 5 to 10 years? What would be the next steps for you?
Okay, well, I suppose as a psychiatrist, I would like to think that we will have probiotic bacteria for treating disorders like depression and anxiety disorders. And I really do think that we have the opportunity to develop probiotics that will have a real impact in relation to depression and anxiety. At a mechanistic level, I think there's over 1,000 strains of bacteria in the human intestine. And really, when we talk about probiotics now, most of us are talking about bifidobacteria and lactobacilli, but there may be many different strains of bacteria in the intestine that could be really beneficial from a health perspective. but we know little or nothing about many of the strains of bacteria in the intestine, what they really do. So hopefully over the next 5 to 10 years, we'll learn more about these various strains. And of course, lastly, I think what I would like to see over the next 5 or 10 years, a better understanding of how gut microbes actually communicate with the brain. I mean, we think we know now, and we have a number of quite plausible explanations as to how gut microbes communicate with the brain. But I think over the next few years, we'll get a much more in-depth understanding of that mechanistic interaction between gut microbes and brain.
Mm-hmm. Yeah, many thanks again, Ted, for sharing your insights. It was a really big pleasure to having you here today. Thank you very much.
My pleasure, Marcus. Thank you very much. Thank you.